This is a surgical camp that provides surgeries for children and adults who are born with cleft lip and palate, that is space in their lips and in the palates, in the gums. The cleft lip and palate are actually congenital defects. They are things that people are born with. So this week, starting today, we are screening up to over 70 patients so that we are able to identify the ones who need surgery and take care of them over the next 10 days. As was earlier said, yes, Social Health Authority covers some of these costs, and we will encourage and help our patients who are screened here and who are coming for these surgeries to be able to register so that they can be able to benefit. For the ones who are not able to register or pay for Social Health Insurance Fund, Operation Smile is coming in to support, alleviate some of those costs.
So this week we are here just to be able to correct those surgeries so that these children are able to live as comfortable as possible. Bigger to that, we're also looking at a partnership with the hospital so that we can also engage and be able to train even people or healthcare providers in the county and the sub-county region so that also these children don't have to travel for 500, 600 kilometers to come to Nairobi for care. And beyond that, as Operation Smile, we're also looking at partnering with the Ministry of Health so that we can also be able to develop policies and guidelines that look at safe access to safe surgeries so that even as a country we are able to promote quality of care and also be able to cascade services at the regional and county level. And the goal is also to ensure that as universal health coverage, which is in line with the Ministry of Health and the county and the government policies, so that also patients don't have to travel for long, they don't have to spend so much money and resources as they seek for care. And especially for these individuals, it's not their choice that they have been born with this condition. So we need to be very sympathetic, we need to be empathetic when you're dealing with these individuals. We need to support the parents also who are having these children. We have had instances where especially a child is born and the father takes away and says, "This in our community, in our family, we have never seen a child with this condition, so maybe it's coming from your end." So we need to support families who have these conditions. We need to ensure even as communities, we also provide more resources so that even we can be able to support those patients in terms of their logistics. We can also be able to support those who are not able to meet their hospital fees so that they don't have to continue with this stigma for long. Because some of the reasons why also some of these patients don't go to hospital for care is because of the cost of the services. To encourage the citizens also to register with the Social Health Authority. My experience is I've seen with other partners, like sometimes the Social Health Authority or SHA is able to cover almost 60-90% of the hospital bill. Again, that's also a good plus because then it ensures that we reduce out-of-pocket expenditure for these families.